issues. We are working for the last 30 minutes to solve these technical issues. And thank you very much for being with us. Okay, I am Dr. Nahid Hassan Rifat on behalf of Excellence for MRCS, and Dr. Hasnat Hakim is with me on behalf of the Excellence MRCS. So we are basically these two mentors are successfully conducting this session for a long period of time, almost 1.5 years, or almost near about 2 years. And with a very successful, we are conducting these sessions, as you know, and that's why you are with us right now in this common platform. So if I want to say about the MRCS journey, then I must say, day by day, MRC is becoming really, really difficult. So if you think about, if you go back 2020 around these diets, and even after 2 years, after 2022, MRCS OSCE was really easier. There was no study materials except one or two, and very tiny. Even one of my friend was saying, previously this station used to come in a very straightforward way. The way the information is settled down or written down in the books, they used to, in the real exam, they used to ask the questions just exactly the way they are written down in the book. Very few stations, and if you are really prepared, uh, or had some well preparation over those books, definitely the candidates used to pass in this exam. But nowadays, the pass rate is really, really declining. New topics has been introduced in the sessions, in the books, and overall the exam stations are really, really changing. So demanding all the situations, whenever I think, demanding all the situations, we just come forward and starting the Excellence for MRCS. And for the 1.5 years and almost 2 years, we are successfully conducting these sessions, and many people has been passed through our way. Okay. So Dr. Hasnat Hakim with us, I would request him to conduct the orientation session. And are you here, Dr. Hastat? Are you here? Can you hear me?
Yes. Am I audible?
Yes, you are totally audible. Please do the conduct the session. I am here with you, and people has joined in the Facebook and some other places. And guys, if you do have any question, please don't hesitate to ask us. I'm here also, and we'll discuss eventually every single aspect of the MRCS. Okay, thank you very
Okay.
much.
Okay. Thank you, Dr. Naizan Kotbai. So, the persons who have joined till now here are already in my course, and Dr. Rameshwar Yadav and Dr. Adil, you already know me. So I want this session to be interactive so that you can clear these ins and outs of MRCS OSCE exam. So hopefully it would be an interactive session, obviously. So as we know, this is the second part and final part of our MRCS Part B examination, and why it is actually termed as OSCE exam. So, what does that mean? So, this is basically oral structured clinical examination. So, by these four terms, you know that is oral. That means you can say that in a knowledge portion. So, you have to give a kind of viva on a particular case on a selected topic. That means oral structured, there will be structured question and there will be a structured answers, and there will be a checklist, and the examiner will just match your answer with their checklist, whether they are structured answer or not, and they will give you the mark on the basis of that. And we have a skill part, so that's why clinical and also examination. So as you can say that this is an practical oriented exam. So that is actually quite different from your previous exam, which is MRCS Part A, where you have actually gone through the books and then after gathering all of the information in your mind, then you have gone through the exam hall and just sorted out 300 MCQ exam, and then you have passed successfully. That is great. But in this situation, this exam orientation is very, very, very important because every station is a bit different. No other station, so like one station is not quite similar to other. Like in anatomy station is conducted in one way, critical care could be conducted in other way, clinical examination station is quite. So here your time is limited, which is 9 minutes, and you have to get oriented with the exam system, how it is actually conducted. So that's why we have arranged this session for tonight, so that you can come up with this exam format. So first of all, few basic things actually. What are the colleges available? We know there are 4 royal colleges, and you can just sit from any of the 4 royal colleges, regardless of your part A. The question that I get most of the time, I have done my part A from the Royal College of England. So can I sit for Edinburgh or can I sit for Ireland? So yes, you can. The answer is simply yes, you can. Like if your party is from Edinburgh, you can sit for any of the other 3 colleges. No issues here. Just you need to do the booking. Just after completion of your payment, they will ask you some of the documents, commonly primary medical qualification and the result sheet of your or the certificate of your MRCS Part A, which is downloadable from your Part A website where you have gone through your Part A. So these are the 2 or 3 documents, and Edinburgh may ask you one more document, that is your last clinical attachment. So that is nothing but just sign it from a consultant, and then you have to send it. Nothing else. So the simplest answer is, regardless of your Part A, you can attend or you can sit in the Part B exam from any of the 4 colleges. And the college from which that you pass the Part B exam, you will get the membership of that particular college. Is it clear to everyone? I hope this question is very much common, and I hope all of you who are present here have no confusion regarding that. Is that okay? Anyone?
Yes.
Okay, so we can move further. So what eligibility that you need? One is, as we have said, primary medical qualification. That is the university certificate that you have got after passing your MBBS. And another one is your successful completion of MRCS Part A certificate. But if you apply for the same college, so in that case, the college might not ask you for MRCS Part A certificate or any of the documents. So these are the 2 criteria that you need to fulfill. I hope all of you actually already fulfilled these 2 criteria. So these 2 are the basic need. So you might ask that, do I need to have clinical experience in surgical specialty or any subspecialty or not to appear in the Part B? So the answer is, if you have any clinical attachment or if you are in a surgical training, that might help you to grab the situation, or it may help you to grab the concepts easily in case of skill part. But that is not a prerequisite or mandatory things. We have got so many candidates, those who don't have any other surgical experience rather than the internship, already passed the MRCS Part B exam with a very, very high score. So, and we have got also few assistant professor, associate professor as well, who actually are not in touch with the basic clinical anatomy, basic pathology, but they have also passed with a very good mark. So, if you have clinical experience, that would be quite easier for you, but that is not a mandatory things. And don't undermine yourself that having a clinical experience doesn't mean that you will not pass. You can pass with your dedication. If you give us 4 to 5 months of time, at least 3 to 4 hours per day, hopefully that would be enough. But the prerequisite is you need to be dedicated, and we will also discuss what you need to do. So basically, this is an OSCE structured exams. So basically, this is a station-based exam. So almost similar to the situation that you can see here in the picture. So basically, you will have a few rows of rooms, and all of them will have some instruction hanging on the door. So look here, just like this situation, the candidates are actually going through the instructions, and then for after a certain period of time, they will enter into the station, and they will have to perform what it is asked to do. So what are the exam stations basically? So usually you will have 17 stations basically, and among those 17 stations, you will have 8 knowledge stations, and you will have 9 skill stations. So basically, these are the two broad headings, because you have to pass in knowledge, you have to pass in skill separately. So we have 8 stations in knowledge, we will have 9 stations in skill, and you will have 2 preparatory stations, and 2 rest station might be present or not. That could be dependent on the exam center. Like if you are a candidate of Malaysia, Kuala Lumpur, any of the centers of the Malaysia, you might have 2 rest stations. But if you give exam in Chennai or Colombo, you might not have 2 rest stations. So that is dependent on the exam center. But 8 knowledge station and 9 skill stations, and here 2 preparatory stations. So one, we will have 2 communication station, we'll go through that, and for that 2 communication station, you will have 2 preparatory stations. So total 21 stations you will have to face in the exam. So basically, in the knowledge portion, among those 8 stations, you will have 3 anatomy stations, you will have 3 critical care stations, and you will have 2 pathology stations. So simply 3 anatomy, 3 critical care, applied surgical science, and critical care, and another one is 2 pathology station. And among history taking skill, you will have 2 history taking stations. You will have 3 clinical examination station. You will have 2 procedural skill. You will have communication skills. So basically, in the skill portion, you have to gather history and formulate a diagnosis in 2 history taking stations. We will come to that. You will have to perform 3 clinical examination station, and you have to formulate a diagnosis or positive findings, and you have to present it to the examiner and to formulate a diagnosis. So 3 clinical examination station and 2 procedural skill station. Basically, you will be asked to perform a simple or minor surgical procedure, like commonly wound suturing. Commonly, you might be given to tie a hand knot, or you might be given to drain an abscess, or you might be given excision and closure of an excision of a nevus and close the wound. So these are the simple, and you might be asked to do a male catheterization. So commonly, these are the common surgical procedures that are asked, and you have to perform that uh, task within those allotted time. And you will have 2 communication stations. One communication station would be with patient or patient's relatives. That means that would be a layman patient, and you have to counsel that patient or patient's relative in layman's term, basically. So they are judging you on the basis of your communication with the patient, or it might be a patient's relative, depending on the situation. And another communication station would be like communication with a colleague. So this could be, can be your consultant. This could be an on-call consultant. This could be an ITU register. So depending on the situation, you need to communicate with a medical personnel. So you will have 2 communication stations, and before that communication station, you will have a preparatory station, which will also be 9 minutes. So these are the broad headlines of the stations. So if we go further, each station will have 20 marks. So the whole exam would be 340. And if we divide that, so your examination would be, so we will have a knowledge portion, 8 station, So that would be comprising 160 marks. And in the skill portion, you will have 9 stations. So that will comprise 180 marks. So total 340 marks. So one question that I commonly get, sorry. So one question that I commonly get that what could be the pass mark? So in these terms, we can say that there would be 8 knowledge stations into 20. We can say 160 and 9 skill stations at 180. So in general, we can say that though this pass mark varies, so roughly you can say you might need 65 to 70% marks. In case of knowledge, 120 is the safest zone, you can say, but sometimes 115 can be a good option, but 120 is the safest. And in case of skill, 125 you can say. So these are the common, these are the most probable list or cut marks that we have seen over the last 5 years. So that is what I can say. So as you have to pass separately, so your pass won't depend on total or cumulative on 340. Rather, it would depend on how you get on knowledge or how you got on skills. Suppose you have got 140, 145 in knowledge out of 160, but you have failed in the skill. Ultimately, your total result would be failed. Sometimes you have got you failed in the knowledge portion, but you passed in the skill. But that will also won't work actually. That will not work in this case. So that is the overview of this exam pattern, like how many stations, what are the times allotted. We'll come to this, and what are the marks distribution, and on a broad heading, what are the stations that you will get in the exam. So before we discuss in a bit details about the knowledge and skills, will come later. Is there any question up to now from your side? Any question from any one of you? Anyone? Dr. Ravi Chaudhary, Dr. Shagor, you have joined us today, might be, and Dr. Sanjeev. So any question from your side? So if you face any question, then don't hesitate to let me know.
Bhaiya, I have a question. Does
Yes.
the pass rate vary among the exam centers, or all the exam centers have same pass rate?
I didn't get your question. All the exam
Okay,
centers?
okay, I got the question, guys. Just uh, ask the questions relevant the previous thing. And if you do have any other questions, just post the question in the comment box. No problem. We'll discuss every single question regarding the MRCS OSCE.
Okay. I think that is
Just
better. Yes. If you have any questions, just to put it in the comment box. That would be a great
okay.
one. Yes.
Okay, and we'll discuss about the questions eventually, question by question. No problem. And don't
Okay.
hesitate to ask any questions. I already told you. Uh, MRCS OSCE, especially MRCS OSCE is the exam previously is used to consider as the MRCS OSCE exam is the exam for the second timers because nobody had any idea about the exam, but this concept had been changed. If you do have well, or if you are well oriented about the exam, that is really possible to pass in the first attempt. That's why I always keep saying all the candidates, if you want to pass the exam, at first you will have to know how the exam is going on and what are the things you'll have to consider, and what is the most important part you will have to emphasize. So orientation class is the most important thing. Remember, guys, this is the most important class of whole session. So just erase or uh, just ask any questions that is knocking at your mind. I'm telling you, don't go without having full conception regarding the MRCS OSCE exam. So it's a huge opportunity to you in front of you right now. We are here to erase every single confusion of you. So if you do have any question, just post in the comment section or chat box. Thank you very much. Dr. Hassan, please.
So thank you. So we will be starting with the knowledge portion. Basically, as we have said, we have three sections in knowledge. One is anatomy, one is critical care, and another one is pathology. So 3, 3, and 2. You will have 8 stations. So basically, the exam setup is quite similar in all of the knowledge stations. Like the total allotted number of time is actually 9 minutes for the station. But before the 9 minutes, you will have 1 minute before that to read the stem, just like the picture. So you will have 1 minute just to have a stem or instruction or a case scenario in short, like a patient who 50-year-old patient has come to you in the surgical outpatient department with the knee pain or in the groin pain. Now you are in this anatomy station, you will be asked some of the relevant anatomy in this inside the station. There's something written, something like that. Like a patient comes to you with a headache and you have given an MRI. So you will be asked some neuroanatomy and you will be shown some imaging inside the station. So something, some of the instructions you will be given on the wall. And that means you they are actually giving instructions that what you are going to do in the room. So that means you will find that this might be an anatomy station because they will ask you some relevant anatomy from that particular region. Suppose a patient with a chest injury, that means you will be asked some of the questions regarding thorax. So you will be shown some pictures from the thorax and you will be asked to identify some of the structures, and then he will ask you some relevant 2 or 3 questions against that particular structure. So basically, you will have to read that stem within 1 minute and standing outside the room. And once the 1 minute ends, then there will be a ring, and then you will have to enter into the station. Then you will have to answer the stations, answer the questions of the examiner. So inside an anatomy station, basically you will find only one examiner. In case of all of the knowledge station, you will have only one examiner. So basically look here, like that there will be a table here, and you will be sitting on one side of the table and the examiner will be on the opposite side. This would be a situation in anatomy, but sometimes there might be another situation, like there will be a room here and there might be the anatomy large pictures, laminated pictures are hanging over the wall. So the examiner might take you to this picture and will ask you some of the structures to identify and ask some relevant questions against that. Then he will take you to this second picture. Then he will take you to the third picture. This is almost similar to that. So almost in roughly, we can say in an anatomy station, usually you will be shown 4 or 5 pictures, and you will be asked 4 or 5 questions from each picture. So roughly you can say you might get 16 to 20 questions in each anatomy stations. So all of them will comprise 20 marks. So roughly you can say you will have to face 16 to 20 marks. So basically you will need to identify the structure first. Then he will ask you some of the structures, like commonly in case of we can say hand. So you might be asked about some median nerve or ulnar nerve. Okay. So then if you identify the median nerve, then he will ask you some of the questions regarding the functions of the median nerve in the hand, something like that. So almost similar. We will show sample station after a few minutes. But once one picture ends, then he will take you to the next picture, then the third picture, then fourth picture. So if you miss one of the structures to identify, in that case you are going to lose, or the examiner will not ask the following questions relevant to the structures. So that is what you actually need to go through. So basically we will have 3 stations. This is a summary. We have said you will have 1 minute to reach the stem, then you will have 9 minutes to perform, and there will be only one examiner, and 4 to 5 pictures and 4 to 5 questions per picture. So basically, what do we do? So here, suppose this is a sample station. So anyone could read the STEM, please. I won't ask you any question. Don't worry.
Sample station candidate instructions. A 22-year-old man is attacked by a dog and suffers lacerations to the dorsum of his left hand. On exploration of his wound in theater, he is found to have several damaged tendons. Your diagnosis is assisting you in theater whilst you perform the tendon repairs.
Okay, so this candidate instruction would be written outside the room. So you will have 1 minute time to read the STEM and think about yourself that what are you going to face. So this might be you know that there might be some hand anatomy that you might face. So once the 1 minute ends, then you will enter into the station. Then you might will the examiner will take you to the picture 1, or he will show you picture number 1. So just he will ask you to identify what is picture number B in the picture A. So what is picture number C? So what are the structures that pass underneath that, or what are the how many compartments are there underneath the C? Or in the then picture number B, so what is structure number E? What might be the function of E? So similar to that, there would be some questions, and the examiner will not show you the questions. Rather, he will ask you verbally, and you will have to answer that verbally as well. And if you can't identify, or if you can't understand the accent of the examiner, in that case, you can ask the patient, so ask the examiner to repeat the question again. That won't do any harm. So the examiner will repeat if you can't understand. That is quite okay and good thing for in this exam. So basically, the examiner who has the question paper or the checklist will have the answers as well. So basically, he will ask you to identify number A to E. So then he will also have the answers. And then if you say this correctly, you will get the 1, 2. And if you say miss these things, okay. So then he will give you marks accordingly. So the more you can get accurate, the more you will get the marks. So then that is how the picture number 1 is done, picture number A. Then he will take you to the picture number B and picture number C. If it is there, he will take you to the picture number 4. So and ask you few questions. Like here, there are 4 questions for the picture number A. So similarly, you will get 4 or 5 questions for picture number B, C, D. So basically, you can ask me that how can I answer 16 to 20 questions in just 9 minutes? So the answer is, in case of anatomy, if you know or if you can identify the structures, you can answer all of the 16 to 20 questions within 5 to 6 minutes. It's very much possible and very much possible. That is what I can say. And anatomy is the punch station to pass in the knowledge portion. As we have said, you will have 3 stations, that is 60 marks, and what you need to pass in the knowledge is 120 among 160. So if you get 55 or more than 50 out of 60 in anatomy, the chances of passing in the knowledge portion is very, very high. Just like anatomy is the trump card to pass in the MRCS Part A, similarly, anatomy is the trump card to pass in the knowledge portion of MRCS Part B as well. So that is very much possible. And I have seen a few candidates as well who have got 58, 59 in anatomy portion. So that is very much possible. And I would say the information or the theory are not dissimilar to the Part A, like the median nerve anatomy. It is also similar to Part A as well as Part B, obviously. So you have gone through anatomy of way vast in Part A. So in case of Part B, you don't have to remember or memorize so many things. Rather, you have to go through selective things. But the most important thing is just to identify the pictures. So identify the pictures, identify the structures in the exam. So if you can identify the structures correctly, you will get the common questions in follow-up to that particular structure. So what books or what materials should I go through? So we have a book, so we'll show that. And commonly or previously, candidates actually used to go through Macmillan and Abraham, but nowadays pictures are not coming from that book. But you have to go through some of the pictures of that book so that you can take or you can have a visual memory. And another thing could be Logan's or Jeremy's cadaveric book. There is another one. And some of the 30% or 20% pictures might be simulated or AI generated. And some of the pictures are actually given from the Grant class or Gray's Anatomy. So those are actually AI generated, and AI generated pictures are actually very easy to identify. But the problem the candidates actually face to identify structures in a cadaveric picture. So if you just go through these things again and again and again, in that case, you might get visual memory. So here, the memorizing the picture is not important. Rather, just try to understand what are the relevant structures or what are the adjacent structures around this region. Like in the picture number B, the structure number H is, we can say, the ulnar artery. So just medial to that, there is a long structure that is median nerve, obviously. So this should not be a radial nerve. So if you think that, and obviously this would be underneath the flexor reticulum. So in that case, median nerve is obviously underneath the flexor reticulum. So if you just correspond the structures, that would be very, very easy for you to identify. So just build a visual memory. And one thing, you might get some information from some of the sources that, okay, this picture might be shown in that platform, this picture might be on that platform, this would be directly in the exam. So this is not the case. In anatomy, I can write you down that the picture, you might not get the exact picture, or you might not get the picture, those are common. Rather, you will get the almost similar picture or similar view of that particular organ, and the examiner will ask you to identify the exact question that we will show you next. So the thing is, you obviously, if you can identify, then you will be asked some of the relevant question which you have gone through in part A, or if you have given FCPS or residency or any other postgraduate entrance exam in surgical specialty, you have gone through those anatomy repeatedly. Those information will be needed here as well. But these are the simple information. But the most challenging part is to identify the structure correctly. And to see this, you need to see the picture again and again and again, and to build a visual memory. That is what you need to do. So if we come into the critical care station, there will be also 3 stations. So similarly, you will have 1 minute to read the stem, you will have 9 minutes to perform, and there will be 1 examiner. And here, within this, you will be asked some question in relevant to that case, and 12 to 15 questions. Like, if we say, suppose this is a sample station. So anyone could read the stem, please, first of all. Anyone?
Mr. Smith, a 62-year-old man underwent right hemicodectomy for right-sided colonic growth. On first post-operative day, patient is agitated and confused. Vitally, his heart rate was 120 beats per minute, blood pressure was 100/70, oxygen saturation was 88% at room air, urine output was 90 ml. In last 8 hours, fluid chart shows he is 7 liter of intravenous crystalloids plus colloids. 4 liter of them are normal saline.
Okay, so this is the thing that you will get only you will have only 1 minute to read the stem outside the room. So you might not need 1 minute, rather you might need 30 seconds or 40 seconds to read the stem. So what will you do in the next 20 seconds or 30 seconds? You need to recall which station is this. And then after recalling which station, you need to just recall a few of them that what are the possible questions that I might face. Like by reading the stem, I can assume that this is a station of fluid overload, which is causing the pulmonary edema. So this is a pulmonary edema station. So in the pulmonary edema station, you might be asked some of the questions regarding. You'll be given an X-ray about pulmonary edema. You might be given an X-ray, and you might be given an ECG, and you might be given some of the pathophysiology of the fluid management. You might be asked about body fluid and the renal compensation relevant to it. You might be asked some questions, acid-base balance. So the questions are actually paid, that are fixed, and you know what are the questions that you are going to be asked, and then you will have to face this answer these questions within 9 minutes once you enter into the station. So in critical care stations, you might be shown some X-ray, you might be shown some ECG, or you might be shown some news chart, you might be shown some fluid chart or temperature chart. So we'll show those charts in our that are included in our books as well, and we'll show in the respective classes. Don't worry. So then you will have to answer the questions. So this is very much common. Like a patient has a heart rate, some vitals, saturation, fluid chart, so many things, and this is very much difficult to grab within 1 minute and enter into the station, keeping all those information in your mind. That is very much difficult. But I would suggest you, if you can't grab all of the information at a glance, so once you enter into the station, just ask politely that may I have the station again, or can I read the stem again? So the examiner will give you the exactly the same stem again to read that. So once you feel confident, then you can say, okay, I'm ready. So then then the examiner will ask you the question. But if you ask to read the stem again after entering into the station, the time would be deducted from your 9 minutes. You will not get any extra time to read the stem. But the thing is, if you can't grab the station or stem within those 1 minute, it's better and it's ideal to read the stem without thinking that it will just cost a few minutes from me. So how can I cope up with that? Will I be able to finish the station within 9 minutes? Obviously you can. So it's better if you can't get, you must ask to read the stem again. So that is the best thing that you can do. So other than that, without getting oriented with the stem, how will you be able to answer that particular question? So that doesn't make any sense. Rather, it is very advisable to go through the stem again if you are not confident enough. But your task is, after reading the stem, you must recall that which station is this and what are the possible X-ray, possible ECG you have gone through in your book, and what are the questions that you are about to be asked in that station. That is your task. So usually there are peri-operative management. So if you are about to take preparation, so peri-operative management, you will get one station, like post-operative fluid management, post-operative pain management, and some of the questions regarding anesthesia, like you will have a station epidural analgesia. You might have a station with transverse abdominal spleen block or tab block, or some of the stations like local anesthetics, and or some new stations like malignant hyperthermia, then post tonsillectomy bleeding. So these are the common stations regarding peri-operative management. And another segment among those critical care would be metabolic condition, like it could be respiratory failure, it could be renal failure, it could be like here fluid overload we have shown in this picture. There might be some metabolic condition of surgical importance, like obstructive jaundice. There might be some esophageal varices. These are the common important stations, and from that segment you might get one paid station commonly coming from the trauma. It might be commonly head injury, it might be cervical spine or lumbar spine fracture, it might be crash injury, it might be pelvic fracture. So usually, so if you divide that segment, so you can get the preparation according to that. But this is a probability. Sometimes you might not get any station from any. Like in my exam, I didn't get any station from trauma. Rather, I got 3 stations from the rest of the 2 segments. So one thing we forgot to mention, that in case of anatomy, on the basis of importance, the head, neck, and neuroanatomy. So there is no MRCS Part B exam where you will not have any station from head, neck, and neuroanatomy. You must have a station. Sometimes you might get 2. So one from head, neck, and neuroanatomy. Then the second most important one is inferior extremity, and the third one is superior extremity. So extremity and head, neck, these are the most important segments of your anatomy. Then there might be thorax, there might be abdomen, but there might be some conjugate stations, like you might be given some pictures from the root of the neck and the upper portion of the thorax. So there might be a half portion from the root of the neck, half portion from the thorax, or there might be some portion from the upper thorax or superior mediastinum, and some of the questions regarding the pectoral garden, like scapula or upper humeral anatomy. So there might be some conjugate stations, but most of the cases you will get a station from the neuroanatomy and head, neck, and one from usually one from the limb, and one from either of thorax or abdomen. So this is the sequence you need to go through, and this is the importance here. So if we come to see the pathology portion, so similar to critical care, but here you will have only 2 stations. And in case of anatomy, a critical care, you will be shown ECG, X-ray, fluid chart, temperature chart, those things. But here you might be given some pictorials, like a cut section or a picture of gangrene, or you might be shown a picture of colon dissection in case of ulcerative colitis or Crohn's disease. So some of the specimen. Or in rare occasion, you might be given histopathology reports or histopathology slides. So commonly histopathology reports are given. So then on the basis of that, you will be asked few questions. So if we think about the segment, usually you will have 1 station from the infection, you will have 1 station from the malignancy. Commonly infection, we have said that there might be abscess, there might be septic arthritis, commonly the most important 2 stations, and you might get actinomycosis, or you might get these are the common stations in terms of infection. And in case of malignancy, you might get carcinoma stomach, carcinoma esophagus, and colon cancer. So any skin malignancy like multiple malignant melanoma. So you might get basal cell carcinoma, squamous cell carcinoma. So those are included in our book. So if we think about a pathology portion, like you will have a simple station, like a patient with right iliac fossa mass has come to you with suspected appendicitis. So appendicectomy was done, and histopathology of that appendix revealed it was an appendicular abscess with a 6 millimeter appendicular mass. So you'll be asked some of the questions following to that. So the examiner will ask you some questions, and you will have to answer those questions. Typically, 12 to 15 questions will be asked, and if you go through that quite nicely, then you can answer those questions within 6 or 7 minutes. That is very much possible. Once pathology was a topic of uncertainty, there were quite new stations invariably or frequently in every diet. But nowadays, newer pathology stations are quite rare, but sometimes nowadays they are actually introducing newer critical care stations. So the questions are also fixed. You know the answer, how to present, and the candidates who are giving the exam, all of them know what are the questions to be asked and what will be the answer. But the candidates who make the difference as how you present the answers to the examiner. The way of presentation is actually quite important here in this case. So I was talking to one of our fellow candidates that that part B exam is not about the knowledge. Rather, it is the exam of smartness, like how you tackle the situation, or how you answer, or how you present your knowledge or deliver your knowledge fluently or smartly. That is what they are actually looking for. Like, what is abscess? You know the definition of abscess. The rest of the 17 candidates who are appearing in the exam also know the definition of abscess. But how will you pass? You will pass if you present the definition of abscess quite nicely in comparison to the other candidates, then you will definitely pass. So that is also important. Not just giving the answers is important, rather giving the answers quite nicely and in a presentable way is also important. So how the marks are distributed here in the knowledge portion? Basically, if we say how marks are distributed, so in that case, we'll show a detailed diagram or table at the end of the session. But if I say roughly, in case of anatomy, you will have complete 20 marks based on your knowledge. So that means in anatomy, if you say or if you can correct all of the questions of the examiner, you will get 20 out of 20, no problem with that. But in case of critical care and pathology, they will also comprise 16 marks, 20 marks as well. But here, if you answer all of the questions of the examiner, but you will not get 20. Rather, among these 20, you will have 16 marks and you will have 4 marks on professionalism. So that means 16 marks for answering the questions of the examiner. But 4 marks is completely reserved on the examiner's hand, that how you present your answer. So that is what I was trying to say. And you can overcome this by having these. We have organized these books according to the way the candidates should present to the examiner. So basically, we will have 24 live interactive classes for the knowledge portion, and we will have 15 live interactive mocks, and we will have all recall questions should be discussed up to January 26. Sorry for the mistake, that it would be 26, not 25. Then we will provide individual feedback, and we are here to clear all of your confusion anytime, 24/7, to clear any of the confusion regarding any of the station. You can ask me, or you can ask Dr. Rifat by any of the time. So there is no time limit. So you can ask me any of the time to clear out your confusion, and we will try to answer from our little knowledge to clear out your confusion. And if we can't give the answers instantly, I personally will make sure that I will gather some information and will give you the most correct answers. And recently, in January 2026, we have launched our 5th edition of Excellence for MRCS OSCE books. And I can assure you, these are the books that contains the latest information up to January 2026, including the KL, the Kuala Lumpur exam, and also the Penang exam. So all of the questions are included. When we are reading, we had to open 4 or 5 books, but these are the books you can go through just reading by one book. These are the solution. And one thing that we commonly say, our books are more popular than our course. So these are the most widely read. And like those who are Bangladeshi candidate, if you go through BMU library, so those who are preparing for the MRCS OSCE, they will have at least one set of book, because this is the most widely read, and it's a compact book which have all of the information which are put together inside a book. So once you go through that, you will find the differences than the other materials available in the market. So we try to collect the questions from the candidates. Like, I personally gather the information from the candidates. Like a person who have exam on January 19, then some of the candidates might have exam in the January 20. I personally call them after the exam that what are the new things that were not included in our book. So, and try to note down and find the answers relevant from relevant books or internets or relevant sources. So, and then our task is to put in the book together. So basically, how would you prepare, and what we are trying to say that the professionalism is important here. So how would you build up that? The most important is to have your life presence in the live class. And another thing is try to interact with the mentors as much as you can. That is the most important way. And if you give mocks, hopefully we will be able to find out your mistakes. And finding out the mistakes 4 to 5 months before the exam is quite handy, rather giving the mocks or grand mocks just 1 week before the exam. So that is not quite handy. And if you have mistakes, you will not be able to correct that by then. So I would recommend you to make your presence in the live class as well as in the live mocks. So if you can give dedicatedly 3 to 4 hours in the live class for regular 5 months, I can assure you that you are going to pass. Not only pass, you are going to pass with a very, very high score. So that is what I want to say from the knowledge portion. So Dr. Rifat Bhai, are you here?
Yes, yes, Dr. Hassan,
So
I'm
before
here.
going to the skill, do you want to make
Okay,
any?
okay. I was listening everything, and you have described every single thing very smartly, and including the pros and cons. And I want to give you a very good news that from our course, nobody, I haven't seen anyone except one or two candidates who failed in the knowledge portion. Because for passing the knowledge portion, one thing you'll have to follow, that is that you will have to stick with the book. On the other hand, you will have to attending the mock session. Most of the time, even I say to the candidates, if you can't attend in the live classes, that is also okay. But if you can't attend a mock session, that is not totally okay. Just just remember, guys, almost 30 or 40 students are present right now, and newer students, and many more students didn't join even in the orientation class. I want to tell you one thing, just listen very carefully. If you if you attend in the mock sessions with the fullest preparation, I can guarantee you are going to pass in the knowledge portions. It's a very important thing. For passing the knowledge portions, two things you'll have to do. One is stick with the books. You can see the three pictures in the sharing slide. You'll have to stick with these three books. I'm telling you why I'm telling this. Second thing, you'll have to attend in the live classes as well as the participating in the mock sessions. Like we'll always try to cover to 4 or 5 instances in a single class. But one thing you'll have to remember, if you can't prepare all the 5 stations, that is also okay. At least prepare 2 or 3 stations and let us know before starting the mock session why I couldn't prepare the all 5 stations. Please consider me these 3 stations, and definitely will give you the slot. I have seen many previous candidates and some candidates who didn't appear in the mock session and was telling me, Rifat, I worked so hard, and whenever and you mentioned everything in the classes, and whenever they asked about these questions, I couldn't memorize, I couldn't remember. Whenever I come outside the room, I could memorize every single bit, but on the by this time, I failed in this knowledge portion. So for the passing the knowledge portions, few keywords. I won't take much time. Just want to say anatomy, anatomy, and anatomy. Number one, because they can't generate new anatomy station because human body is fixed, so they can't generate new anatomy stations. So one question, one station from the head neck portion and neuroanatomy, and if you're lucky enough, then two stations might be from head neck and neuroanatomy. This is fixed, and another station from the upper limb or from the lower limb. These are fixed stations. Nowadays, some station from the abdomen, some station from the thorax. Thorax sometimes comes along with the neck portion, but these are fixed portions. So if you are well prepared with the anatomy, it's very simple to get 55 marks out of 60 marks in three stations. And considering the pathology and the critical care stations, Dr. Hassan also said, critical care stations are fixed also. You will get so much lengthy stations in the critical care, but they won't ask so many of questions like 12 to 15 questions within 10 minutes. And he already discussed about the pros and cons. But you will have to prepare well in the critical care as well as the anatomy. So if the pass mark varies always, almost 115, 110 to 115 out of 160, because you're going to get 8 stations in the exam and 20 marks for each station. So the pass mark almost varies 10 to 110 to 115. So always try to acquire more than 115 marks. So for getting the 150 marks, you'll have to focus on the anatomy and the critical care. Sometimes newer stations coming in the pathology. Pathology is very simple but lengthy. So you'll have to focus on the anatomy and the critical care. Number one. Second thing, you'll have to attend in the live classes. Remember, guys, if you want to know a secret, if you want to ask me, Bhaiya, now you're discussing about the knowledge portion. So what is the easiest way for passing the knowledge portion? I must say there's a very straight cut, simple way for passing the knowledge portion. Attending the mock sessions must with the fullest preparation. That is the key, guys. If you don't attend in the mock sessions, I can give you the guarantee that you are going to pass in the exam. So work hard for the long 4 or 5 months, prepare very well on the knowledge portions, and it's nothing, it's very simple, and definitely you'll pass the knowledge portions. And these books are the bestseller books for the MRCS OSCE exam right now. Nobody in our country, even some doctors outside our country, are collecting these books. They're calling us, and we do have to send some way, some DHL or some other ways. So these are very famous books. Even Dr. Hassan said these are more famous than our course, because for MRCS OSCE exam, whenever we used to prepare the exam in our time on back 2023, we used to gather 3 or 4 books together, and we used to, like, we are going to prepare the neuroanatomy. We used to open 3 or 4 books together. But what did we do? We compiled all the books, all the newer pictures, all the informations together, and just launched these books. That means you don't have to open any other book except this one. This is the important thing we'll have to know. So don't go anywhere else. Don't open any other books except this one. These are quite enough to make you pass with the biggest mark. If you talk with the previous candidates who has passed in the exam, talk with them and you'll come to know. So So thank you very much, Dr. Hasnat. Just now come to the skill portion. Thank you. So guys, if you do have any question regarding the knowledge portion, just drop your question, and at the end of the session, we'll discuss about your questions. No issues. Dr. Hasnat, please continue.
Okay, so we got one question that where do we get books from, please? So you are already in our course, so you will get them in our website along with your course. So don't worry about them. So the thing is, no one in the world will be able to just present the case or present the answers quite nicely just by reading once or twice. If you think that, I would say that you are living in a fool's world. So the thing is, don't think that you are just, these are the simple knowledge portions. Then you are going to read, okay, I know these things, okay, these are very easy, and I'll be able to present those things. But by reading once or twice, if you think that you will be able to answer perfectly in the exam station, then that would be really, really difficult. And in case if you give the mocks to us, I will be able to find out at least 10 mistakes if you go through that station for once or twice. So it's better to do the mistakes before appearing the exam rather than doing the mistakes within the exam. So we got one question, that is there any instruction regarding dress code in the exam or restriction on hijab? So usually there is no restriction in the dress code, but I would suggest you for the male page candidates, usually half sleeve shirt or full sleeve shirt. If you wear the full sleeve, you have to fold the sleeve, because in the clinical examination you have to just put off your shirt up to your elbow. So that is what you need to do in case of clinical examination, in case of procedural skill, in those stations. But try to wear one color or simple plain or light colored shirt, those like official attire. And in case of female candidates, you will not be allowed to take any watch, any ornaments within the exam hall, but there is no restriction to wear the hijab. Hopefully you've got the answer. So moving to the skill portion. So basically, as we have said, we will have 9 stations and 2 preparatory stations from the skill portion. So if we come to the history taking portion first, so these are the another punch station to pass in the skill portion, just like the anatomy, which was in the knowledge, and history taking is in the skill. So I would say there are usually there are 2 history taking stations. But in this case, the setup of the history taking room would be something like this. So the room, and there will be a door here, and instruction will be written over the door, just like the picture we have shown a few slides back. So you will have 1 minute to read the stem, and then after that you will enter into the station and to perform the station within 9 minutes. So your 9 minutes will be divided into 2 segments as well here. So once you enter the station, you will have a table here. So there will be 2 examiners sitting over here, and there will be a patient. This would be patient, and this would be a chair, that is you. And on the other side, there will be 2 examiners. One would be your surgical examiner. One would be your layman examiner. So basically, you will have 20 marks in this station. So you will have 6 minutes to perform or to take the relevant history from the patient. So 6 minutes from that. And once the 6 minutes ends, you will have 3 minutes to face the examiner, basically the surgical examiner. So he will ask you to present your case, and he will ask you a few relevant questions like how do you investigate the patient or how do you manage this patient. So a few basic questions basically. So for that, you will have 3 minutes. So total 6 minutes from the patient for the patient and 3 minutes for the examiners. During the initial 6 minutes, you will not be allowed to talk to the examiner, and in the next 3 minutes, you will not be allowed to talk to the patient. So here, basically, few domains are tested. Like you will, in the first 6 minutes, you will have to take the history from the patient. So basically, for the history taking, you will have 8 marks. So out of 20, you will have only 8 marks. So if you can take or gather the history perfectly, that might only, or if you can ask all of the questions regarding history taking situations, like the patient has abdominal pain. So if you ask all of the questions regarding abdominal pain, regarding family history, and regarding occupational, regarding personal history, so all of the things, if you can complete the history, you will get only 8 marks. So where are the 12? So look here, you will have 4 marks on professionalism. Like you have gone there and you have sat on the chair and you are actively listening to the patient. So how to listen actively? One is suppose the give the room to the patient to speak more and more. Don't interrupt the patient. That is what one way. While the patient is talking to you, you can just actively listen, like do the head nodding, maintain the eye contact, and don't lean backward on the chair, rather lean forward on the chair. Like this is a chair and you are here and sitting over here. So lean forward, don't lean backward. So do the head nodding, maintain eye contact, lean forward towards the patient, like you are giving the priority to him. And if the patient cries or if the patient says something uh, uh, absurd, so you need to appreciate that to the patient. And sometimes if the patient might be sorrowful, like the in case of family history, patient might say that he has lost his mother. So in that case, you show some empathy. The patient might cry. So in that case, you might offer some tissue paper which are kept on the table of the examiner, or there might be a glass of water. You can offer that. In the headache station, there might be a patient who will have a headache, and in that case, the patient might not be agreed to proceed through a conversation with you. In that case, you might offer some analgesia or some painkiller medication to the patient, or you can ask the patient or ask the examiner to turn off the light or to dim the light of the room. So these are the way of professionalism, and these things will have 4 marks. So this is it. And then you will have 4 marks on communication. So how do you communicate with the patient? Like you are asking the patient that, or how you are instructing the patient. Like there are some questions like idea, concern, and evaluation about the patient. Like you are trying to. So suppose you have taken the history from the about abdominal pain. Like now you are asking the patient that what's your idea about this condition, what do you want us to do for you. So that means you are prioritizing the patient and you are taking the emphasis to the patient's concern. So these are the communication that you need to build a rapport with the patient. So more or less how you are instructing. And the most important thing is you are not allowed to use any medical jargon. Rather than you have to simply use the medical layman term. Like in case of abdomen, we use the tummy. In case of esophagus, we use the food pipe. In case of stomach, we use the food reservoir. So these are the layman terms. Like in the bowel, we can say, or you can say the back passage. In case of going to toilet or micturition, we say loo or water passage. So these are the layman terms that you can use to explain the examiner to the patient. Sorry. So another thing is like you are talking to the patient, giving 2 or 3 information. Then you can ask me that are you getting me or are you following me? So just whatever you say, just ask the patient that whether the patient is actually getting to you or not. Don't give too many information to the patient at a glance. So these are the systematic way to get more marks in case of communication. So you need to build a rapport to the patient. Like you will have a piece of paper to take the appropriate note from the history. So in that case, if you write on the paper, there might be a break of the eye contact. In that case, you can seek for permission to the patient. So that is what you can do as well. There is a history taking station like erectile dysfunction, where you need to ask some private questions like conjugal life, like sexual life, those things. And patient has to share some of the very confidential, very personal answers. In that case, you in that history taking station, you can ask for a chaperone in that history taking station. So that is also a part of professionalism in this station. So these professionalism are subjective in relevant to that particular station, and then you will have 4 marks. So look here, you will have only 8 marks to take the history, but equally you will have also 8 marks on professionalism as well as communication. And lastly, you will have rest of the 4 for presenting the case and giving some answers of the questions like investigation and management. That is what 20. So it is very much possible to get 36 or 35 out of 40 from the history taking station. If you can get that, your passing in the skill portion would be quite easier for you. So that is what we can say all about from this history taking portion. So commonly follow the steps. We will have 10 steps approach in case of history taking portion. We have included in our book, and we will discuss those things in our respective class. Show empathy and professionalism, because you will have 4 marks on that, and try to build up a rapport with the patient. Give emphasis on the patient's what the patient is actually trying to say. Like in case of history taking, we have usually 4 segments. One is open question. How can I help you? What brings you here today? Patient will say so many things, and you will have to appreciate that. You will have to actively listen those things, and then you can narrow down your questions to formulate your diagnosis, and you can just you will not be allowed to do the rush. Rather, simply and quite ask the patient and give interval or pause, and don't interrupt the patient, and give the patient chance to ask or to answer your question. So just show empathy and professionalism and instruct the patient clearly so that the patient can understand. That is how we can build the communication or rapport with the patient. And memorize the common differential. So one thing, you will have 1 minute before entering into the room. So here you will have a picture or a stem written over here. So basically, you will understand that a 19-year-old girl with sudden severe abdominal pain has come to you in the emergency department. Now, as a SQ1 trainee, you are allowed to, or you are about to ask or take relevant history from the patient. So obviously, you will be able to know that this might be a case of acute abdominal pain. So in case of acute abdominal pain, you need to see that this is acute pancreatitis commonly. So you know the diagnosis. And then your task is, within the rest 30 or 20 seconds, 20 or 30 seconds, you need to formulate the other 3 or 4 or 5 differentials, what you are going to exclude within the room. If you can't fix that, you are going to be in a big trouble. Like I can say that this is a case of acute pancreatitis. We know. So there are some differentials like acute cholecystitis, acute appendicitis, peptic ulcer disease, so, or it could be myocardial infarction. So these are the common differentials or acute abdominal pain. So you can exclude those differentials. So just think what are the 3 or 4 differentials you have to exclude before entering into the room. So once you enter, then ask those questions to the patient so that you can finish within 6 minutes of allotted time. That is what you can do. And another thing is, like I have said, that acute abdomen or abdominal pain, that is acute pancreatitis, that might be parectal bleeding, the diagnosis is carcinoma colon, the diagnosis, if the patient has difficulty in swallowing or dysphagia, the diagnosis is carcinoma esophagus. So why is that? So we know that parectal bleeding has so many causes. It might be IBD, it might be carcinoma colon, it might be hemorrhoid. So anything could be there. But in case of MRCS Part B, the diagnosis is fixed. The patient will give you the lead in favor of a fixed diagnosis, like a parectal bleeding, the diagnosis would be carcinoma colon. So why is that? They are actually looking for whether you can take the proper history or not, whether you know that what are the relevant history that has to be taken or not. That they are actually judging that whether you are capable or competent to take history. They are not looking for whether you can diagnose a rare disease. Not like that. They are here actually to see whether you are competent enough to take that history or not from a layman. So this is what they will actually judge you. So like in case of you will have a station like I can say like headache. In case of headache, the diagnosis would be, suppose, subarachnoid hemorrhage. The diagnosis is fixed. And while reading, you know the diagnosis, the differentials could be brain tumor, the differentials could be meningitis, the differentials could be hypoglycemia. So these are the common differentials. In that case, the differential can be migraine. So usually you need to differentiate those. So these are the 4 differentials you can exclude. So if I say headache, the diagnosis is subarachnoid hemorrhage, and rest of the 4 differentials has to come within your mind within 5 or 10 seconds. So if it comes so, you can think that your preparation is complete. In that case, you know what are the questions to be asked against brain tumor, what are the questions to be asked against meningitis, what are the questions to be asked against migraine. So you know what are those to be asked. And after reading the stem, within the rest of the 20 or 30 seconds, you need to face, okay, these are the 4 differentials. I would say, I would exclude, and I would present this thing to the examiner, and the examiner will obviously ask you, what are your differentials? These are the differentials you will present to the examiner. That is what you can do. Hopefully, this is the summary of history taking station, I would say. So if you have any question regarding history taking portion, you can simply ask me, no issues. Okay, so this is a simple history taking station, and commonly a patient with 77-year-old male which has come to you with some complaint like frequency, urgency, poor stream, and it's happening like for 6 months. And now you are about to take history, relevant history from the patient to reach a diagnosis. So you will have 1 minute to read this. So this might be a bladder outlet obstruction. So commonly the diagnosis is benign enlargement of prostate. So the common other differentials might be carcinoma bladder, or this might be urinary tract infection, this might be stone disease. So you need to exclude those things in the exam. So the next portion is clinical examination. So a very crucial portion where you will have 3 stations, and the candidates actually panic in this type of station. But the good thing is, most of the candidates, specifically in the subcontinent, the candidates actually, this is the segment they practice the most. So clinical examination station. So you will have 3 clinical examination stations. So basically the setup would be here, this is the room. You will have, similarly, you will have a stem outside the room here, and you will have 1 minute to read the stem. And then once you enter into the station, you will have a table and you will have an examiner. Only one examiner would be there, and he or she will be responsible for complete 20 marks. And there would be a couch, and a patient would be lying over here. And a chaperone or third person might be there inside the room. Sometimes he or she might be present or not. If the chaperone is not present, in that case, you can make your examiner as a chaperone during the clinical examination. So this is the scenario. You will have 6 minutes to complete the clinical examination and 3 minutes to face the examiner. Within those 3 minutes, you will not be allowed to talk to the patient. So marks breakdown. If we go through the marks list, okay. So if we go through the marks breakdown, in that case, we will have total 20 marks in case of clinical examination. So just like history taking station, if you complete the clinical examination, you will have only 8 marks. So if you get worried, okay, I didn't do that particular step on the examination, that doesn't make any big difference. So, or if you don't, or if you miss a simple or silly steps, it won't make you fail. It only comprises only 8 marks. So it may lose 1 or 2 marks from your exam. So what you need, or what's the most important thing is, you will have 4 marks on professionalism. Like, what do you mean by professionalism? Like, you have entered into the station, you have done the greetings quite professionally to the examiner, to the patient, and you have collected the patient's name and age of the patient, and you have simply explained what you are going to do with him, and you have made sure that what are the areas of the body portion need to be exposed, like your chest has to be exposed during the examination, or your tummy needs to be exposed during the examination. You are making aware about this to the patient. Another thing is, I would say that chaperone, like in case of inguinal hernia examination or hydrocele examination, or you are about to examine the chest in case of respiratory system or cardiovascular system. So you are about to do the chest examination of a female patient. So these are the private parts. So in that case, you must make sure a patient that there is a chaperone or third person inside the room. So you need to make sure that. And if you don't forget, so we would advise to make sure you have chaperone in all of the clinical examination station. Just ask that my examiner would be acting as a chaperone. So one is greeting yourself, confirm the patient's name and age, and then verbalize why you are here. That okay, I'm here to do your tummy, and I'm here to look, feel, and listen tummy, and I'll do some movements and special test. And my examiner would be acting as a chaperone. And during the examination, you need to expose your gown, or you need to remove your gown, or you need to expose your tummy. So are you okay with that? So these are the things. These are the parts of professionalism. Like, you are ensuring the patient's chaperone or patient's privacy. You are respecting the patient's position. You are respecting the patient's exposure. You are greeting yourself. These are the parts. And before touching the patient, do you have any pain? This is also a part of professionalism. Like, a patient has painful limb, painful joint. You should not move that joint forcefully, obviously. So that is a part of professionalism as well. So you will have 4 marks in these type of things. Another 4 marks would be there for communication. Like, suppose you are about to do a special test, like commonly, as I say, commonly in case of shoulder, we have some special test. So about to test the rotator cuffs. In case of hand, there are some phalanx test, Foreman's test. So commonly for nerve examination. Like in case of spine examination, we have SLR test. So these are quite strange to a layman person. So the best thing is, while performing a special test, it's better to have some instruction to the patient. Okay, and obviously make sure that the patient doesn't have any pain. So just build that. Do the commentary throughout the exam. Okay, I'm going to do this. I'm going to do that. You are doing completely fine. If the patient can obey your instruction, just appreciate the patient, that the patient is instructing, patient is abiding your instruction. Patient is not bound to follow your instruction. As the patient is doing so, you must appreciate the patient. Okay, Mr. Alex, you are doing great, those things. Even if the patient can't do, you can say, okay, that is completely nice, or you have done quite nicely. So just appreciate the patient. And in case of any of the special test or any unusual step, just explain the patient. And if the patient can't understand, in that case, like, do it on yourself and ask the patient to copy that. Like in case of suppose a special test, like what do I say? Like in case of phalanx test, you need to bend, do a reverse prayer position. Patient might not understand. In that case, just show it on yourself and ask the patient to do that on yourself. So that is what you can do. So just give the instruction to the patient as easy as possible. If you need to act, then act on yourself. And yeah. So the most important way and the most professional way is verbalize. If you can't verbalize in the exam, or if the patient is layman, in that case, obviously the patient would be a layman. Sometimes there would be a medical person who would be in disguise of a layman. So in that case, the most easiest way is to explain. If the patient can't explain, then act. That is what you can do. And rest four are actually for presenting the case and answering the follow-up questions. That is what the 20 marks. So just doing the clinical examination in a robotic way will get only 8 marks. 8 marks and 4 marks for answering the question. 12 marks. So 12 marks will not be enough to pass. So you will have also the 4 and 4 for communication and professionalism. Don't try to be robot. So try to be empathetic to the patient and make things easier. And it's your task to break the ice of the patient. So we have also already discussed these things. So we have 24 or 25 examination stations in our book. You will find that no other examination station are out of this. So one out of these 3 would be from orthopedics, as written it is. So it might be shoulder, it might be hand, it might be knee, it might be ankle, it might be spine. So these are the examinations. One of them you might get from orthopedics. You will have systemic examination. Commonly, the most important one is cardiovascular examination. One could be from respiratory, one could be abdominal, or maybe it could be care of critically ill surgical patient protocol. So these are the common systemic examination, or might be from neurological, like nervous system examination, commonly cranial nerve or cerebellar examination. These are the common systemic examination that you might face, or vascular system examination, like commonly chronic lower limb ischemia, or you might get varicose vein examination, a very important one. And another one could be AV fistula, which is rare basically. And it is also important that most of the Bangladeshi candidates are about to give the exam in the Malaysia. So there is a vascular center, University of Malaya Medical Center. So if your center is there, you must get a vascular case. It might be from the cardiovascular examination, or it might be a vascular examination like varicose vein or chronic lower limb ischemia or AV fistula. And vascular patient would be a real patient. So in case of orthopedics, the patient would be an actor, but in case of systemic, the patients are usually a real patient. And in case of swelling, the patient might be a real, might be an actor. Most of the time, the patient would be an actor in case of Malaysia, but the patient might be a real patient in case of Colombo and India. So swelling. In case of swelling, the swelling can be any swelling from the back, over the back, or over the chest, commonly lipoma, or any sebaceous cyst, or it could be from parotid, submandibular, it could be from thyroid swelling, it could be breast lump, or it could be inguinal-scrotal swelling. So these are the common swelling examinations for the MRCS OSCE exam. So from the 3 segments, you will get 3 portions. So same again, follow the steps. We will also have 10-step approach in case of clinical examination. Show empathy and professionalism. We have said, how can you show the professionalism after entering into the station? Like you have entered. So greeting is a part of professionalism. Showing the dignity of the patient. How much would you expose of the patient? That is also. And mentioning that chaperone, that is also a part of professionalism, to conduct a proper clinical examination. And another thing is, you can say that, okay, do you have any pain? So asking the pain, also a part of professionalism. Also. These are the things. And memorize the common differentials, like a knee pain. You are about to examine the knee. So you know, it could be osteoarthritis, it could be septic arthritis, it could be TB, it could be malignancy, any of the things. So common differentials. Like in case of, what do I say, in case of parotid swelling, it could be pleomorphic adenoma, it could be pyelolithiasis, it could be mumps, it could be sarcoidosis, any of the things that you can say. So mention the common differentials that could be. So then just the rest of the questions are saying, how do you investigate? in relevant to your diagnosis or to establish your diagnosis, and how do you manage. All of the things are written and simple and paid. All of the candidates of your exam day know the answers, but who present it in a nice way will make the difference, because you will have marks on professionalism and communication. And basically, your lay examiner will have 8 marks on those communication and professionalism, and your surgeon examiner or surgical examiner will have 12 marks. So simultaneously, both of them in the history taking station will give 20 marks, but in the clinical examination, only one examiner will be there. He will give you the total 20 marks. So a patient here with a right knee pain 20 years back, while fell from a running bus. So you are about to do the right knee joint examination. So this is what they are actually asking for. So you will have to do the knee examination. So though it is asking for the right, you have to examine the left one as well. So you will have to do the knee examination basically. That will have 8 marks for communication and professionalism, 8 marks. And so sometimes you might forget to see the suppose quadriceps bulb, and candidates are crying, why I didn't do this, why I didn't do this. So it don't make you fail. It might have only 1 mark, but whether you have perfectly instructed the patient, did you are you able to give the instruction properly to the patient? That is important. Did you ask for chaperone or not, or did you ask for pain to the patient or not? Those are important equally. So that is it. Okay, so in case of procedural skills station, this is actually there will be 2 stations. Just like history taking station, you can get maximum marks in this portion, and that will help you to pass in the skill portion, history taking and procedural skill. These are the punch stations where you have to get as many marks as you need. So usually on a broad heading, we have 6 or 7 procedural skill stations. I hope most of you know. One might be listing a theater station, one could be knot tying, one could be suture braiding, one could be own suturing, one could be male catheterization, one could be in the UK centers commonly tube tracheostomy. So these are the common procedural skill stations. So basically, there would be sometimes 1, sometimes 2 examiners would be present inside the room. So basically, there will be a room. You will have 1 minute to read the stem and what you are going to do. Same as that, 1 minute. And within the room, there would be a bed. Patient would be lying over there, and 1 examiner would be present here. Sometimes there might be 2, and there will be an assistant to assist you, and you will have 9 minutes completely to complete the procedural skill station. So here, basically, the examiners won't ask you any question. Rather than you will have to do the procedural skill or procedure and communicate with the patient. Ask the patient's name, age, or check the wristband of the patient, take informed consent, and make sure the patient has given the written informed consent or not. Ask for WHO safety checklist, and give the post-operative instruction regarding analgesia, regarding antibiotics, when the patient will do the dressing, when the patient will have to do the stitch off, when the patient will come back again, and for the follow-up. So these are the things that you need to give to the patient. So all of them combinedly will have 20 marks. So only doing the procedure will not have 20 marks. Rather, you are giving the procedure the right instructions and doing the right things will have marks. And after doing the clinical procedural skill, whether you are disposing the appropriate instrument to the appropriate station, like a needle into the sharp bin, gloves in the yellow bin. So whether you are mentioning them, That is important. There might not be any bin. They are actually looking for whether you know the protocol, whether you know what is the right thing to do. So they are actually looking for that. Like after every procedure, it is important to note down or having a documentation. So they will also look for that whether you are asking to document the procedure or not. So simply, you don't have to document, but they are actually looking for that I need to document this procedure. So they are actually looking for that. So that will also have marks. So basically, here they will actually look for the overall impression, whether you can conduct the procedural skill station, whether you can perform the procedure, whether you are instructing the patient, and whether you can handle the suture material appropriately and discard them appropriately or not. They are actually looking for those things. So same thing, and don't forget to give advice actively. Sometimes if you don't give the patient advice, suppose there would be a own suturing. Patient has a cut injury on the anterior aspect of the thigh, and you are about to do the own suturing of the cut injury. So you are doing the own suturing silently. In that case, the examiner will ask you some questions which might not be needed. So some of the irrelevant questions. What you can do, just keep busy yourself, keep yourself busy, just trying to communicate with the patient. Like if you continuously do the stitching and say the patient, okay, Mr. X or Alex, you need to come on that day, you need to take this antibiotic, you need to take this painkiller medication, you need to do the dressing on that day, you need to do shower on that day. So if you give the instruction appropriately, and the examiner will not have the floor to ask you the question. That is how you can actually avoid those questions. And another thing is, in this station, your task is to complete the procedure and give the advice, patient's instruction actively. That is what your task. That means you are doing the procedure and post-procedural advice. That is the objective of this station. But if you don't do that, or if you don't give those information to the patient, in that case, the examiner would ask you some irrelevant question, and ultimately you will be distracted to answer the examiner's question, and you will stop the procedure, and your 9 minutes will end, and your procedure will be incomplete, and you are going to fail. Okay, anyone could read the step, please. Any one of you? Dr. Abhishek. Okay, I think he's not here. So basically here, this is, you will be Dr. Sarah. That means you will have to address yourself as Dr. Sarah. So you are working for Mr. Mann, who is a consultant surgeon in the Oxford University Hospital. So he was supposed to go for a mole or nevus excision from a patient who is Jane Smith in front of her right thigh. So unfortunately, Mr. Mann is not available at this point. So you, as a part of his team, are about to excise the lesion. So you will have 9 minutes to complete the station. So basically, what you need to do, so you need to do greet yourself, confirm this is the right patient, right side, right procedure, these things, and then you need to counsel the patient that why you are here, why Mr. Mann was not there. Because the patient was here to do this excision by Mr. Mann, but unfortunately, he is not here. So as you are doing this, you need to counsel, say sorry, why you are here, and then I would say, okay, these are the points in favor. Okay, so these might be these are the parts of professionalism, and as well as once you do the procedure, do the nevus excision and give the instruction what antibiotic, what analgesic, when to do the dressing, when to take shower, when to do the stitch off, when to come back for the histopathology. So these are the information that you need to give the patient while doing the procedure. If you don't do, the patient examiner will ask you what is the dose of local anesthetics that you give, what is the mechanism of action, what are the complications that could arise from lidocaine. So that are the queries that the examiner will ask you. But then you will be distracted, but your main objective was supposed to excise the lesion and give the post-operative instruction. But you are not doing that. The 9 minutes is a very short time in case of postural. It will go in a blink of an eye. So ultimately, if you can't complete, so you will not be able to finish, and then you will not be able to say the documentation and disposal, and ultimately you will lose those marks as well. And ultimately, in that station, you are about to fail if you do something like that. So person communication. So we have two communication stations. One is person communication, another one is phone call communication. So we will have two communication stations basically. So one is person and one is phone call. So basically, in case of person communication and phone call, you will have a preparatory station each before proceeding to the performing station. Like in short, if we say you will have a room here, here you will have a stem, you will have 1 minute to read the stem. Once you read the stem, then after 1 minute, you will enter into the room. Then there will be a table, there will be a patient's file, and a pen and paper. There will be no person inside the room. You will have 9 minutes to take information from the file and to prepare yourself for the next station. Once the 9 minute ends, you will enter and you will come out of this room and then come in front of the next room. You will find the similar instruction that you have found here. And then once you enter into the station, you will find a table here, a lay examiner, a surgical examiner would be sitting over here. A patient would be sitting here, just like a history taking setup. So almost similar. Then in this case, you will have to counsel the patient regarding the corresponding situation for 9 minutes. This is the only station where the examiner will not ask you a single question. They will just silently observe. They will not ask a single question to you. You will have to just explain the whole situation, what the patient actually wants to know. You will have to explain this. And the way of professionalism are actually quite similar, just like history. Like actively listen, do the head nodding, maintain eye contact, draw a diagram if needed, and explain it in a nice way. And don't give too much information to the patient. Just ask two questions, and then are you getting me? Did you get me? Or do you have any question? So just simply try to explain in a detailed way so that the patient can understand you. So that is your task. If the patient cries, you know what to do. If the patient says headache, you know what to do. If the patient complains about pain, you know what to do. So these are the things, these are the parts of professionalism. That is what you need to do. And now you can ask me that what are the things that are written in the file. That is very easy and very simple. You will have 8 person communication station that are paid station already in our book. No worries. We will discuss in the respective class what are the background of that case and what are the things the patient would ask and how you counsel those situations. That is what we will discuss in respective situation. So basically, active listening. So how would you listen actively? We have said. Second thing is empathy and rapport. That means just try to maintain a proper and clear communication. Give the emphasis of the patient's dignity, patient's vision. Whatever the patient says, just respect and appreciate the patient's concern. Professional conduct. So the thing is, what you can do professionally that you must have. Like in case of a patient who has splenic hematoma, and that you are not allowed to give the discharge to the patient. So what you need to do, that doesn't mean you will not give any kind of treatment to the patient if the patient takes discharge against medical advice. you must warn the patient about the warning signs when to come back. And suppose after a procedure, what would be the advice? Like a patient after mastectomy wants to leave the hospital. So in that case, you must make sure that the patient knows the warning signs when to come back again to the hospital. So these are the professional conduct that you must show the patient. And body gesture, we have said, head nodding, eye contact, all of those things, and apologize again and again, even if it's not your fault. Like in the last station, the Mr. Man was not here, so you must apologize, though that is not your responsibility, but you must apologize to the patient. Like a patient, you will have a patient's wife is waiting for 2 hours for a CT scan machine, but you are about to break the bad news that CT machine is not available. As the patient is waiting for too long hours, you must apologize to the patient. So that is your task. So apologize again and again, even if it's not your fault. Like a patient was taken to the emergency theater for emergency appendectomy or emergency splenectomy, but mother is here and she doesn't know anything else, and you didn't see the patient. So what you can do, just apologize to the patient. That is what your task, and simply say what you can do, and ask for permission to have a conversation in a detailed way. So these are the important aspects that you can do. So this is a case, a blind patient who is here to do the inguinal hernia repair. But the problem is the patient is taking warfarin, but your consultant has suggested to stop the warfarin before the operation. But the patient's cardiologist said that he shouldn't stop the warfarin pill. So that is what he remembered. Now he has some concern that why should I stop this? My cardiologist said that. Now you are about to say to stop that. So he has some concern, and you have to clear out the confusion regarding heparin, regarding warfarin, and regarding the bridging therapy of the heparin and warfarin. How do they act? What are the side effects? And the patient is a blind patient. How a blind patient would inject the subcutaneous heparin in his body? So you need to counsel these things to the patient. So we will show these things in a respective station. Don't worry about that. What are the concerns the patient would actually ask? Everything is known to everyone. But the thing is, how do you present? And in case of phone call communication, this is the most important one. Where do the persons actually get the least amount of marks? So if you know the case, you will get higher marks, and that would be very much possible to get a very handy mark. So the setup is quite similar, just like the previous station. You will have one empty room where you will have patient's file, and you will have a pen and paper, and you will have to gather the information within 9 minutes. If you know the files, if you know the background, a 9 minute will not be a big deal. But if you don't know the case, if you are not well prepared, just went through once or twice during your preparation, in that case, it would be a big mistake, and it would be very difficult to find out those 15 or 16 pages patient file within 9 minutes. And you don't know what question you are going to face the next station if you don't, or if you are not oriented with that file. So if you are oriented, you know what are the questions you are going to face in the next station. So you need to sort out within 9 minutes, then come up from the next station. And here you will have a table, you will have another file almost similar to the previous station. Just you have to make sure that this is the similar file. You will have a telephone, and there will be a phone number. You will have to dial those things, and then examiner would be sitting somewhere there, but not inside the room. And you will have to just confirm the consultant who are you calling, and then explain your case according to the S-bar protocol. And then the examiner would ask you some of the questions, then you have to answer. Okay, So if you don't know any answer, don't lie. Say that, okay, I don't know, or I might have missed the answer, or I can't remember or recall the answer. So I must make sure once I'm off the phone, and I'll let you know. So this is the way of professionalism. Suppose the examiner might ask you, what is the potassium level of the patient? Somehow you didn't notice that, or you missed that, or even the potassium report is not available in the file. So if you don't know, don't say anything on the base of assumption. Rather, if you say you don't know this, that will enhance your professionalism. That will not lose your mark if you can't say the level of potassium. But if the potassium level is 4.2, and if you say 3.2, you are going to do a big mistake. So follow the instructions properly. Don't lie. Maintain the situation, background assessment, and recommendation protocol, and apologize if you can't answer, and make sure you will answer those things to the examiner later on. So here we can say all of the stations will have 20 marks, as we know. But look here, the communication. Here the communication will have 12 and 8, 20, and here 24. So 20 and 24, 44 marks here. And here you will have another 48 marks. So you will have 340 mark exam. And among communication and professionalism, you will have 92 marks. That means almost 1/3 of your marks will come from the communication and professionalism. That means from your smartness, how you deal those things. Don't worry, we will show in the respective stations how to build a professionalism in particular stations, how to build good communication with the patient, and how you should, what are the things has to be remembered in that station. We will show that, don't worry. And what are the things not to do in that station, that is also important. So 92 marks, and the rest, like the knowledge portion, you will have those marks. And most of the candidates actually know the answer. So just giving the answer will ensure this row, but how you present will depend, this will make the variation in this 92 marks. That is very, very important. And you will have clinical and technical skill in case of clinical examination, and procedural skill station. That is the breakdown. And your pass mark is in the knowledge and skill are separate. You have to pass in both domains. So this would be your exam result in your final. So RCS will mail once your result is published. So you will have this mark. So here, this is the knowledge portion, these two columns. So, and these two are the skill portion. So look here, skill is 180 and here is 160. So how can we help in the skill portion? So we will have 17 interactive classes. We will have 8 live interactive mocks, as well as we will have recall questions that are included in the book, and as well as the updated study materials, updated stations, updated scenarios are included in the book. So that is what we have made this a valuable tool for the MRCS OSCE candidates. So I would recommend Dr. Rifat Bhai to say something about skill portion. And we have simulation
okay.
course, and I would recommend you to say something about that as well.
Okay, thank you, Dr. Hasnat, for giving me the plot once again. Regarding the skills portion, I don't have anything more to say, just to add you with you. For passing the skills portion, the total depends on the candidates, not on us, because skills portion is really difficult. We will show you the exact way as a virtual platform. We will let you know how to do the clinical examinations, how to do the procedural stations, and every single other things. We can only guide you, but we can perform you on behalf of you. So we'll show you how to perform those things, and if you don't practice in a very regular basis with your friends, it's not possible to pass in the first attempt or subsequent attempts. So another thing, I have seen many candidates who was just telling Dr. Rifat, I have practiced several times, like the clinical examination, like the procedures. Still, I couldn't pass the exam. So I asked him, "Did you practice well? That's totally okay, fine. But did you practice under the supervision of some expert mentors or some person who knows whether you are performing in the very perfect way or not?" He was saying, "No, I just practice," and he was just stuck, and he come to know that he didn't practice in a perfect way. So first thing you'll have to remember, you'll have to practice, and definitely you'll have to practice under the supervision of some expert persons. That's important. And skill portion is difficult. I must say, skill portion is difficult. But if you know how to perform the skills in a very perfect way, and if you follow us blindly, I can assure you, you are going to pass in the very first attempt, because the two mentors, Dr. Hasnat and me, we Alhamdulillah, we acquired a huge mark in the skills portion in the real exam when most of the candidates fails in the exam. Both of us found very high score when the result was really bad on that particular session. So I can confidently say you, we will able to guide you in a very perfect way. And if you could follow us blindly, you are going to pass in the exam. But you will have to follow. That is important. Regarding this case portion, Dr. Hassan always say two things you'll have to focus mostly to acquire the marks, that is the history taking as well as the procedural stations. Just think, you'll have to practice only 6 procedural stations, and out of 6 stations, you will get 2 stations in your exam. And to know or to practice the procedural stations, only 4 or 5 hours is enough. So just simply for within 4 or 5 hours, you can prepare your 6 procedural stations, and you'll have to follow the 10 steps approach. Still, the candidates are not passing because they don't know how to perform these stations. On the other hand, you are going to get 2 history stations by practicing 22 stations. So it's very simple, and almost all the stations are looking like same. You'll have to follow the same format and every single thing. So still the candidates are not passing the exam because they are not following the exact strategy, exact what we are asking them to follow. So that is also important. And the most important part on the skills portion that you will have to struggle a lot, that is nothing but the clinical examination. There are 20, almost 25 plus minus stations in the clinical examination part. And remember, this is the part you will have to practice the most, because all the clinical examination stations are different. One station differ to another one. Like the procedure stations, almost all the procedure stations are looking like same. We'll have to follow the 10 station approach. All the history taking stations are same. We'll have to follow the in a common format. But clinical examination stations always differ one from another. So that is the important part. And this is the part from where you will get the maximum amount of stations. You'll get 3 stations. No other stations you will get, no other part of the clinical exam skills portion you'll get the 3 stations. So this is the important part. So practicing under the supervision, some other mentors or some expert persons, this is important. Now come to some general concept. So whether you would like, I have seen many candidates who used to clear the Part A exam while they were just preparing the or doing the internship, and immediately after internship, within 3 months, they passed the OSCE or Part B exam. That means their whole journey was about to 7 to 8 months or 10 months. On the other hand, I found so many of candidates who are just struggling with the MRCS OSCE exam. They appeared in the exam twice, thrice, even fourth time. Still, they didn't pass the exam. So, the choice is in your hand. At first, decide whether you want to pass the exam or not. Don't be the second person. So, what is the difference between the first one and second one? The first candidates used to do the live classes, participated with us, and whatever the class length, no problem. They used to stay with us. If your mentor can stay, can conduct the class just 4 or 5 hours in a row, so why can't you attend in the classes? So if you want to show some excuses, definitely you can show some excuses. You do have some exam, you do have the duties, and you do have so many of things, but no one is busier than me or Dr. Hastat. Just believe me, guys, you don't have any idea how busy we are. So whatever the excuses are, all the excuses are invalid to me. If you want to do the classes, you will manage the time for the classes at any cost. Number one. The second thing, they used to do the or participate in the mock session, but not only the attending, they used to participate in the mock sessions very actively. I haven't seen anyone in our courses who attended the classes, attending the or participated in the mock sessions and had failed in the exam. No, you can show any example like this or who has failed in the exam. So whenever you will reach in a certain point of your knowledge, with your knowledge, definitely you are going to pass in this exam. On the other hand, what about the second type of candidates? They appeared in the thrice or four times, still they failed because they are so much busy. They didn't do the classes, they didn't know, they didn't prepare their studies, they didn't appear in the mock sessions. Even we didn't know whether they are going to appear in the exam or not. We just seen them in the hands-on or some other places before the exam, just come to know that they're attending the exams. So don't be the second type of candidates. If you want to second type of candidates, just make sure you are going to fail in the exam. So don't be the second type of candidates. Second thing, many of our candidates are requesting us to conduct the classes in Bangla. No, this is not possible for us because it's a international platform and your whole exam will be conducted in the English. Remember, guys, it's not the linguistic exam, it's not the occupational English test, some other IELTS. So if you are weak in English, nothing to worry about. Just start practicing. Whenever we used to start this course, we used to struggle to finding the exact or perfect word for continuing the classes, but nowadays it has been overcome. So it's not a language exam. Just go with the flow, practice and practice and practice. Ultimately, it will be subsided. Okay. And Dr. Hasnat already broken down all the marks about the skills portions. And I know you already forgot about that. But we will repeat these things several times. Whenever we will start the anatomy classes, definitely we'll give you some input and whole concept about the anatomy. Whenever we'll start with the history taking sessions, we'll give the whole concept of the history taking 1 second. So we will repeat this whole orientation subsequently in a particular way or divided way. So everything will be in your head, so nothing to be worried about. And another thing, I am warning you that our classes will be extremely lengthy. Sometimes we get that we do have the 40 or 40, 50 candidates are going to appear in the next exam, and in the regular classes, you are not getting any candidates to conduct the live sessions because they are thinking all the classes are 4 or 5 hours. It's really difficult for them to attend the live interactive classes. But I am telling once again that will make you a pro candidate if you attend the live classes and mock sessions. And sometimes we just keep behind our operations, some other busy schedules, and come in front of you to take the classes, and you are thinking only to do the recorded classes, and that really demoralizes us. Sometimes we come with huge energy in front of you, and candidates are not joining in the classes, and we lost the interest, because if many candidates are, or almost some candidates, always like to do the recorded classes rather attending the live interactive classes. If we want, definitely we do have 4 or 5 sessions recorded versions we can give you. Even in the field, in the market, you will come to know some candidates are providing you like the videos from 2020 or 2019, but the exam scenario has been really changed a lot from 2019 or 2020. Now 2026, the whole exam scenario is totally changed. So while you are appearing in the 20 2026, and you are doing that 2019 classes, so it's not logical, because everything has been changed. So your both of your mentors are hugely energetic. Just take as much as you can from us, because I can confidently say you, nobody can guide you better than me or Dr. Hasnat. So your both of mentors are extremely energetic. So just make proper use of your mentors. And so, in a nutshell, if you ask me where I want to pass within 4 or 5 months, so what can I do? So I'm requesting you, at first, make a whole routine, make free time. If you are engaged with some other works, just keep away from those works for 4 to 5 months, and manage 6 to 7 hours studies every day, and collect a very serious reading partner, and do the regular classes, prepare the whole study for the mock sessions, and appear in the mock sessions. This is the important thing. And if you follow the whole thing, like right now I have discussed, if you can't pass in the exam, just change my name. Because I am damn confident about that. If you follow these instructions, you are going to pass in the exam. So I won't say anything more, because everything has been discussed by Dr. Hassan very perfect way. So I don't have anything to give more input. So guys, do you have any questions? If you do have any questions, just drop in the question book. So we are getting some questions. So Dr. C, I think Dr. C is from the UK. Where do we get books from, please? So our books are 2 ways. You will get the books in 2 ways. One is the website. You will get the soft copies from the website. If you're habituated to study the soft copy, you can directly go through the books from the website, number one. And if you, as far I know, you are from the United Kingdom. So if you want to collect the hard copies, you can contact with our support system. They will guide you, and they will manage to send these books through the DHL. No issues. It's possible. Okay, Dr. Lavani, is there any instructions regarding the dress code in the exam, or restriction for hijab wearing candidates? No, Apu, no restrictions for the hijab. It's not a big deal, because exams some exams are conducting in the Middle East countries, so it's very normal to have the hijab. So okay, any formal dress is okay. Like you are going to appear in the exam and you are wearing the jeans pant. So you are doing, while you do the clinical examination, it's not possible to lie down on the floor and some maneuvers. It's not possible. So any official dresses are okay. Any formal dresses, shirt, pant is okay with in, and normal shoes. Not Don't go there with a shari, right? Because while you are doing the clinical examinations, so it's difficult to manage the shari as well, the patient's leg, while you are doing the lower limb examination or some varicose vein examination. So wear any formal dresses. That is okay, no problem. Are you getting me, Dr. Labuni? Did you get your answer?
Can I ask you a question just because I don't know if
Yes, Bhaiya, I got my answer. Thank you for
Okay,
explaining
okay,
nicely.
okay.
just
Second thing,
uh,
should we carry equipments
Yes,
for the
Dr.
clinical
Collins. Dr.
examination?
Collins, you are
yeah,
trying to
thank you.
say yes.
Yeah, just because I can't see the books yet on the website and I don't know if there's a
Okay, you
problem
will be
in
given the access of the books, Dr. Pauline, no
okay.
issues.
Yes,
Okay?
tonight.
All right.
So your course has just started.
Okay.
Okay.
Then Dr. Lavani again asks, should we carry equipments for the clinical examination, like measuring tape regarding clinical examination? Okay, okay, Dr. Lavani, you are allowed only to carry the stethoscope, nothing else. If you go without the stethoscope, that is also okay, no problem. Even I didn't bring anything, though it is written down in my exam script that if you want, just bring a stethoscope with you. But I didn't. I forgot to bring this, take this stethoscope while I go to the exam. So every single equipment for performing the clinical examinations and other steps of the exam that will be provided. And always remember, whenever you are preparing the clinical examination after entering the exam hall, while you're talking, hello, good evening, I'm Dr. Rifazon, surgery candidates, may I confirm your name and age, please, and take the verbal consent and ask about the pain and wash your hand. While you're doing all those things, before starting the inspection, g- gather all the equipments in front of you. In my real exam, I entered into the room and sat down in front of the patient, and the station was a submandibular gland examination. And you, in the submandibular gland examination, you need some torchlight, tongue depressor, some cotton, some other things. And every equipments were kept behind me, just near to the door in a trolley. So it's very illogical. While you are doing the examination, at the middle of examination, you are just searching for the equipments and you are keeping behind the patient and you are going somewhere else to collect the equipments. It's not logical. That's why my request would be, before going to the inspection, gather all the equipments, and every single equipments will be provided to you in the exam hall. If you don't want to carry the stethoscope, that is also okay. But if you want, you can carry the stethoscope. Are you getting me, Dr. Labuni? Yes?
আমি গেলে
Yes,
কাকে
Bhaiya, I
দিবি?
got your answer.
ইয়ে দিয়ে দিবি,
Okay,
তেল দিয়ে
fine.
দিবি, বুঝছিস?
So, do we need to address the examiner that I am counting him a chaperone? Okay, Dr. Muhib, that's a nice question. Dr. Hasnat was saying about this today also. The in the real exam, you do have the like the checklist. In the exam, in the examiner's hand, they do have a checklist. So the marks you will get whether you are uttering the word of the chaperone or not. No problem. You can mention my examiner for managing, for the time management. Like you found the spine examination, and spine examination is extremely lengthy and it's really difficult. If you are a pro candidate, still if you are a pro candidate, it's really difficult to complete the whole examination within the time. So if you are asked, so have a look. If you are asked, do you need a chaperone? And the candidates will say, yes, I need a chaperone. Then you'll look at your examiner, sir, patient needs a chaperone. So that is one scenario. On the other hand, you know that this patient needs chaperone because the patient is a male patient and you are a female doctor, and the patient will have only his in his shorts. So definitely you'll have to keep a chaperone. So you can simply mention my examiner will act as a chaperone. That means the checklist carries the marks only for mentioning the chaperone. That means you are saving some time. So that is important. Dr. Hassas was saying MRCS OSCE exam is the exam for the smarter people. How can you handle the whole situation is important. I have seen so many of candidates with a very little preparation, they even pass the exam in the first attempt. So if you practice a lot, definitely you will become a smarter candidate. Dr. Lavani also asked when will you get the full schedule. We are thinking to take our schedule is almost fixed, but we are thinking to take our first class tomorrow before the Eid, and after that there will be no classes, and you'll get the subsequent classes after the Eid. So hopefully we'll take the first class with abdomen tomorrow if you want. So Dr. C already found his answer, I think. So I have fourth edition book. Should I buy the new edition, Bhayas? Dr. Sadikur? Uh, within the it's your answer. Within the 2 years, almost 2 years, we just launched our fifth edition of books, right? So I told you that MRCS OSCE exam is changing a lot. They are bringing newer stations day by day. And after each exam, we talk personally with the candidates of these stations, and we just find out what are the newer questions, because almost 10 to 15 questions will always be added with the previous questions, right? So we always try to collect or gather the newer stations or newer questions, and we include those questions in our new editions, and we publish. So if you do have the fourth edition, nothing to worry about. I think you shouldn't buy the new book, because the newer edition will be given through the website to you. So while you will take the classes, you will find few newer questions, and just write those questions or include those questions in your fourth edition. And those things will make the edition fourth to fifth. So nothing to worry about. You don't need to buy new books. Just have a cross check with the website version, because in the website this is the fifth edition. Just get the newer questions and add those questions in your book. Is it okay, Dr. Sadikur? Are you getting me?
Yes, Bhaiya, thank you.
Okay, welcome. So guys, do you have any more questions? Anyone? It is the opportunity to erase all of your confusions regarding the MRCS OSCE exam. Just let me know. Or ask Dr. Hasnath. You can ask any of us. So do you have any questions, guys? Yes or no? Someone tell me. Yes or no? Do you have any
No,
questions?
Bhaiya.
Okay, that's great. So hopefully we'll get our. So do you want the class before the Eid? We want to conduct the first class tomorrow. So do you want?
Yes, Bhaiya, I think you can take.
Okay, that's great. So we'll have the first class tomorrow with the abdomen, and after that we'll have the Eid vacation. Then we'll continue our classes with him uh, regularly. So thank you very much, everyone. Dr.
Bhaiya, one
Hassan.
thing, Bhaiya.
Yes, yes,
Uh,
Dr. Sadikur.
Tomorrow will be probably the Lailatul Qadr. So it will be tough to join
Yes,
the
that's why
classes.
I was just asking. That's why.
Yes,
Okay.
Bhaiya.
Just allow some time. Just let us fix the whole routine, and we'll let you know, right? And after the Lailatul Qadr, that is the day before the Eid day, so that is not also logical to take the classes, right? So just allow us. I will just discuss together, and we'll let you know. Okay, Dr. Sadiq?
Okay, Bhaiya, inshallah, Bhaiya.
Okay, that's great. Everyone the who attended the sessions, and Dr. Rameshwar Yadav, thank you very much. You are very regular candidate, but you always keep silent. I don't know. You are from India, right? Are you from India
No,
or
no,
Nepal?
sir. No, I'm from Nepal.
Okay, I have visited the Nepal last week
Actually, this is me for
in the
interrupting.
Pokhara.
Can I leave the session, please?
Yes. Our session is done. You can leave. No problem, guys. So
Thank
thank
you
you very
so
much,
much.
guys.
The orientation
Thank
class
you.
was really good.
Okay, thank you everyone. So good night, guys. We'll post the new routine as soon as possible in the group. Thank you very much.
Good
And
night,
rest
Bhaiya.
of you will get
Thank
the
you.
access. Those who already haven't will get the access by tonight. And the summary is actually in a nutshell. The passing in the exam is the just having your presence in the mocks and classes. Mocks, importantly, is the most important one. So I would recommend you to have your mistakes corrected by before the exam, not having in the exam. So that is the most important task that you need to do. And we will have, so just I want from 3 to 4 hours daily for at least consecutively 4 to 6 months to pass in the exam. So you can write it down that no one will fail if you dedicatedly give those time and correct your mistakes by giving the frequent mocks. That would be very, very easy to pass in the exam. So if you have any question, then let me know or ask me in the Telegram group or Telegram inbox. We are here to answer. So make your dream into reality. So it's time to write your own story. So we have shared so many success stories in our Telegram, in our Facebook page. But this time, hopefully, by the end of 4 or 6 months, we will be able to see something from your. So we are almost about to end our today's session. It's been a lengthy session, quite almost more than 2 hours. So do you have any question? So this is the last time I'm asking that, do you have any question? If not, I would ask Dr. Rifat Bhai to end the session if he has to say anything else.
So thank you very much, guys. I think nothing to add more, and I'm really, really grateful to our one-man army, Dr. Hasnat Hakim, for conducting the whole session so nicely. I used to do this job previously, but he is now doing this job very perfectly. And guys, one thing I can assure you, the dedication is yours, and the way will show, and your your dedication and our technique and our strategy and combination of these two things, you will reach your final destination, that is passing in the exam, the first attempt, not the second one. So prepare yourself for studying for the 4 or 5 months in a row with the fullest preparation. And I am requesting you, please, please, please don't dare to absent in the any single classes. That will really, really keep us down and make us down to continuing the lengthy classes. It's really difficult to conduct a whole class like for consider 4 or 5 hours without having any candidates. If you are giving your fullest preparation, definitely we will give you the full preparation, full effort. So thank you very much, guys. I think it's say to goodbye for time being, and we'll come in front of you with the new classes and we'll let you know the date. Thank you very much. Do you have anything to say, Dr. Mohib? Do you have anything to say, Bhaiya?
No, Bhaiya, it was a wonderful orientation. Thank you.
Okay, okay. Dr. Raju, do you have anything to say, Bhaiya?
No, I don't have any question, but I want to know, or I have a suggestion that the time of classes, like
Okay.
it's difficult if the class start after 10 p.m.
No, no,
I
no, no,
think,
no. The regular classes will be after 9 p.m., Bhaiya. The regular classes will be at
okay,
9 p.m. and the mock will be 10 p.m. And we come to at this time, and we have fixed this time after for long 1 or 2 years of experience. And believe me, this is the perfect time for us, like, with having a very busy schedule, right? So
okay,
this
I
is the fixed
understand.
time.
Understand. There are different type of doctors, those who are
Yes,
practicing
yes,
or
yes,
busy
yes.
busy schedule. Okay, it will be all right, I think.
Okay, okay. So
Thank you.
anyone, Dr. Redmi 9 Prime, do you have anything to say, Bhaiya? And Dr. iPhone, do you have anything to say? Okay, I think they don't want to give any more inputs. So it's time to say good night for time being. We'll come in front of you with the new class. Goodbye, guys.